everyone. I'm Dr. Gordon. It's my pleasure to invite you to tonight's webinar with Medimpex and the Association of General Practitioners of Jamaica. Good evening to our esteemed presenters, Dr. Earl Wright and Dr. William Aiken. Good evening to our sponsors, Medimpex, represented by a manager, Mr. Warren Morrison. And good evening to our technical team, represented by Samuel Aaron. And Sam is responsible to see that tonight's webinar goes smoothly. Finally, good evening to all our attendees. We are expecting a very large audience tonight, and we hope you all had a good day and you will enjoy tonight's presentation. It's a pleasure of the Agpj to team up with Medimpex to host this webinar entitled Anxiety and Depression, Effects of COVID-19 on Patients' Welfare and Behavior. And we'll also discuss the hot button topic of ethics, social media, and the physician. Medimpex and Agpj has had a fruitful relationship over the years, and it's only natural that we continue this beneficial relationship. Medimpex is a very strong and faithful supporter of the Agpj. They are usually at our quarterly meetings, and we can always rely on their support. We look forward to continue the relationship with Medimpex. The aim of this workshop is to highlight the effects, the emotional, mental effects of COVID-19 on patients' behavior and how it affects their daily life. The second half of the webinar deals with ethics, social media, and the physician. And you know that this is a very, very, very controversial topic at times. At the end of each presentation, there will be a question and answer. Question will have to be typed and they will be answered in chronological order. To get things going, I will introduce our first speaker. Our first speaker is Dr. Earl Wright. Dr. Earl Wright is no stranger to us. He has spoken at Agpj's workshop on several occasions. He's a consultant psychiatrist. He's also president of the Jamaica Psychiatric Association, a member of the Medical Council of Jamaica, and chairman of the Mental Health Technical Group of the Ministry of Health and Wellness. He is a past director of mental health and substance abuse services in the Ministry of Health. Previously, he held a similar position as director of community mental health services for the state of New York for the borough of Manhattan. He is a Kingston College old boy and a medical graduate of the University of the West Indies. He completed his postgraduate medical education at Harlem Hospital, Columbia University, New York, where he did his psychiatry residency. He also obtained a master's in public health specializing in community mental health from Columbia University. At the Harlem Hospital Center, he became the clinical coordinator, staff psychiatrist of the consultant liaison service. His next position was chief of service and director of residence training for Manhattan Psychiatric Center, New York University. He later took the position of medical director for the Upper Manhattan Mental Health Center. He returned to Jamaica in 1980 for 2 years and for good in 1992, during which time he worked as medical officer of health in St. Thomas Health Department before taking up the position of the director of mental health at the Ministry of Health. During his tenure as director of mental health and substance abuse services in the Ministry of Health, he guided the process of integration of mental health with general healthcare services in the government health service and championed the promotion of mental health. He acted on many occasions as chief medical officer in the Ministry of Health. As you have heard, Dr. Wright is very qualified to speak on tonight's topic, and I'm sure he'll bring a lot of highlights to tonight's talk. Please welcome Dr. Wright. Dr. Wright, over to you, sir.
Thank you very much, Dr. Gordon. I'm going to be talking tonight about the stress and also look at the pressure. If the outline of the program, we're going to talk about the symptoms of too much stress. As you know, one of the things in medicine, as you see patients with anxiety and depression, when you talk to them, you find out that it is usually precipitated by some stressor. And then we'll move to mental disorders and how to manage it. From a practical point of view, stress can be considered to be any physical, chemical, or emotional development causing strain. And if you see, I hope you've seen it on your screen, you're seeing stress, and stress affects the brain. It's through the brain that we take in stress in our body, and we secrete corticotrophin releasing factor, and that stimulates the hypothalamus and through the pituitary to the adrenal gland. And with the adrenal gland, you have the fight or flight hormones, the cortisol, and the noradrenaline that's going to make us deal with the stressor. And that happens regardless of what is the stressor. But how you perceive your stress is determined by your cortex, your executive brain. And that modulates the stressor, how you perceive it. What might be stressful to one individual will definitely not be stressful to another individual. And stressors can also be occur within the brain, perceived stress. So stress really is the wear and tear our body experience as we adjust to our environment. It has a physical and emotional effects, and also that no one you always will be stressed. The only time you won't be dealing with stress is when you're dead. So any change in life is gonna cause stress. And that's why this talk might be important with COVID, giving us all, bar none, stress. The stress, the stressors that we're talking about, that comes from eustress. Stress, the body doesn't differentiate between good stress and bad stress. It reacts in the same way. So if you got married, or if you won the lotto, or if whatever you perceive, you got a promotion at work, etc., the body reacts as a stressor. That's the stressor. It might be eustress, but it's still a stressor. And then we go into the distress. The stress comes from bad sources, the COVID-19, the election, the financial problems, the relationship problems, the threat to personal integrity, violence, and difficult working environment. General stress has distress sometimes is resolved within a few days. We weren't meant to have stress for long periods of time. The primitive man dealt with his stress quickly and move on within a day or two and move on. And cumulative stress like COVID-19, where this is going to go on for an exceptionally long time. We don't know what it is about, when it will end, and we're talking about the new normal. And the new normal is especially stressful because we don't know what that new normal will be. And then there is post-traumatic stress, it's severe stressor, where you have severe stress that changes the chemical in your brain. Stress damages your mental health and moves you to another level. It changes how we are going to perceive life down in the future. Each of us will deal with stress differently. Some of us are vascular responders, our blood pressure gonna go up, we will have hypertension. Some of us are muscular responders. We'll have tension in our back, we have back pain, we have neck pain, etc. All of us will, if we are under stress, our immune system will be compromised because stress changes our immune system, moves how we react to immunity, moves the body's frontline defenses to that which is needed for the defense of that particular stressor. And if we don't take care of the stressor, one of the things we know is that during high periods of stress, individuals will start having more infections. They come to us, you come down with the more common illnesses. And if you're under stress, especially in this period, you become more susceptible to whatever is going around. Some of us respond to stress by sweating. We have start cold sweat, the place is not hot. You're having an interview, the air conditioner is on and the sweat is pouring down your face. I'm sure that has happened to some of us. And what is important is that you do things. And also indigestion. It's not, our body wasn't meant to eat while we are dealing with stressors. So if you eat while you're under stress, then the digestive system doesn't operate as well as it should. Therefore, you will have digestive problems. Therefore, it's important to develop the stress response, to manage the stress, to take care of the stress, to do things to alleviate the stress and move through the dealing with the stress and reacting to the stress, coming back to homeostasis. Otherwise, you are going to run into exhaustion and then you will begin to develop physical symptoms. The acute stress is all parts of our body react to stress, and therefore you start to develop physical symptoms, start to get psychological and medical problems when you are not managing stress sufficiently, effectively. The cardiovascular individuals are going to start having cardiovascular problems, the stroke, the myocardial infarction, and the hypertension. And the reason for that is that in people with increased stressors, you have increased atherosclerosis. Therefore, you are potentially more liable to develop a cardiovascular problem. And the research shows that individuals with depression and under severe stress, usually sometimes up to 9 times more higher quickly, will get myocardial infarct. The incidence is increased with individuals with stressors. Also, the digestive problems, you have the indigestion, the Crohn's disease, etc., all related to stressor. And it's the evidence is overwhelming that chronic stress has been associated with the development of insulin-resistant diabetes. And the reason for this is all comes back to increased levels of cortisol in the body. The evidence is very clear that even at rest, when there is a stressor, the body is secreting increased levels of cortisol. And that in itself will damage a number of organs in the body. In people with clinical depression, it has been shown that individuals will have up to 1,000 times more levels of stress than individuals that are not under stress. And people with depression, the levels of at rest, the levels of cortisol circulating in the body is increased. And when your level of cortisol is increased, this is going to affect a number of conditions. It has been shown if you have increased levels of cortisol, then you are going to have, it's going to damage your hippocampus. And if you remember from your physiology, the hippocampus is the organ in the brain that's going to convert short-term memory to long-term memory. Therefore, if your hippocampus is going to have a problem with your hippocampus, then you are going to have problems with your memory. And that's one of the reasons why with memory, you in depression and anxiety, your memory is not as good as at other times. And if you have a severe stressor, your post-traumatic stress disorder, then your memory might be permanently damaged. It all goes back to how you manage stress. All goes back to two things: your early life, your genes. Certain people have inherited genes that don't allow them to manage stress effectively. So there is a genetic predisposition to how you will manage stress. And then, as you know, the mind and its function emerges from the biological functions of the brain. Therefore, how you manage stress and your mental disorders, the anxiety disorders, and the depression are really set up from the early years. It has always been known for a very long time that if an individual who has a significant loss early in their life, as separation from a mother, separation from a significant person in their life, is going to be more susceptible to develop depression later on. And what you see now is the difference in the brain in the early years. If you look at this at birth, 6 years and 14 years. If you notice at 6 years, the connections are very tight, 14 years. And I'm not too sure what my brain would look like if you took a slide of it right now. Might be very thin. And this is a very important slide to me. I hope you can see it, because what it shows, let me go back and see if it will run. No, it's not gonna run. So let me, if you look at it, yes, it's coming up. In the preschool years, you all know about vision, that if you have strabismus, it's gonna be a problem. Hearing, all set by age 5. And your biases, how you react to things, and emotional control is set by age, and most of it happens by age 4. So how a child is brought up, what you are exposed to early in life is going to determine to a large extent how you manage your emotions later in life. And therefore, the importance of having the early childhood support symptoms. Let me touch on what are the things that happens when stress is not managed. It interferes with clear judgment and makes it difficult to have a need. It damages your frame of mind. Let me try. No. Damages your frame of mind, and then, oh, let me change from this. Can I come out of this? No? One sec.
Yeah, Doc, you can come out of it. You can just press escape.
Okay. Okay, let me.
There you go. Yeah.
Ooh. Yes. Yes. Is that good? Yes. It interferes with clear judgment and makes it difficult to take the time to make good decisions. Where you need good physical skills, it gets in the way of fine motor control. It can seriously destroy your enjoyment of your work. It damages your positive frame of mind. You might need to high quality work. So what anxiety and stress and depression does, it changes how you see things. I always say that if somebody with depression gets a Mercedes Benz, they're going to start wondering what sort of accident they're going to get into with the Mercedes Benz, or if they win the lotto, they're going to start thinking about somebody coming and robbing. It's damaging your positive frame of mind, damaging your self-confidence, promotes negative thinking, disrupting focus. It consumes mental energy in distraction, anxiety, frustration, and you become more irritable, which is an energy that you could use otherwise. It reduces your personal effectiveness, being more forgetful, being unreasonably negative, underline unreasonable. It stops you from making realistic judgment, making more mistakes, being more accident prone. Somebody that always come into the doctor with accident, always consider why this person is always having accident. And individuals, one of the things you notice about patients under stress, whether with anxiety or with depression, neglect of personal hygiene. Their nails are not as clean, they don't usually put on the lipstick. And there's also the change in working habits. They are not doing the work as they usually do. And one of the major problems with anxiety and especially depression is increased absenteeism. Yawning, talking too fast, too loud, fiddling and twitching, nail biting, grinding teeth, drumming fingers, defensiveness, irrational, being irritable, being overly critical, and then you move to the aggressive behavior and the overreaction to things emotionally. One of the major changes is changes in sleep. And one of the early symptoms of anxiety and also depression is insomnia. You go to bed at 9, 10 o'clock, you are still up at 1, 2 o'clock, and you fall asleep and you're up at 5, 6 o'clock. Or you go to bed at 7 o'clock and 6 o'clock you pull the cover over your head and you say, boy, I'm not going to work today and I'm not taking on. So change in sleeping pattern and change in appetite, and it goes both ways. Some people eat too much, start putting on weight, and then there are those individuals who start not eating. Sexual disorders, major problems in anxiety, aches and pain, frequent colds, asthma, back pain, etc., feeling of intense. The major symptoms of anxiety and depression that people in Jamaica come to their doctor about, can complain about, is feeling tired, lethargy, unexplained tiredness, and unexplained lethargy, not feeling good. And clinical depression in Jamaica affects about 10 to 18% of the population. And approximately 38 to 40% have symptoms of depression that don't meet the criteria for clinical depression. When you say mental in Jamaica, and I know this group is not a part of that, but people tend to move to schizophrenia. That has changed quite a bit. That's 1% of the population. We don't have a good prevalence study for anxiety disorders or disorders in children and adolescents. And there's also the substance abuse disorders. The men especially goes to the bar and they drink to self-medicate their anxiety and their depression and try to solve the world's problem. They don't talk about what's really bothering them. They talk about everything else. So drinking is a major problem. And in the elderly, especially in individuals with early dementia, they become depressed, realizing that something is causing a problem. Common anxiety symptoms: feeling nervous, restless, having a sense of impending danger, panic, or doom. And they come to you in the emergency room with a complaining of palpitation. When you do a EKG, you don't see anything. Hyperventilation, also a major problem. Unable to think about anything other than the thing that is present, worrying, like a loop in their brain, keep going round and round, a sort of obsessive thought thinking about one specific incident. And then there's a sweating, trembling, again feeling weak or tired and unable to concentrate. We would have to do a whole segment on the different segments, different types of anxiety. Depression, the most common mental problem, other than anxiety. Most common mental problem that doctors see. And the complaint is about depressed mood, feeling sad, unhappy over the past 2 weeks. And the criteria is over the past 2 weeks, most of the days, most of the time. Diminished interest or pleasure in activities, significant change in appetite, insomnia, hypersomnia, psychomotor agitation or retardation, tiredness or lack of energy, lack of concentration, indecision, unable to make up your mind, and then we move towards thoughts of death and dying. And suicide is a major problem with clinical depression. It's cost us a lot in the society due to absenteeism, presenteeism, and the cost at work, the cost with children. If a mother is unable to have postpartum depression, is unable to take care of her child, then that child's brain is not going to be developed as a mother who is not depressed. So it touches at least 2 generations, and also taking care of the elderly at home. Treatment for anxiety. Always, always look for what are the stressors. You need to talk to the individual and find out what has changed recently in the individual's life. What are the stressors? Is it COVID? Is it financial problems? Is it relationship problems? Relationship problems is a major cause of stressors and anxiety. The treatment, talk therapy, talking through to change how they see things and to relieve the stressor. Also, short-term treatment, and I underline short-term treatment, anxiolytic RX, because the treatment with the anxiolytic, the Valium, the Xanax, and the others, you're gonna run into problems with addiction and tolerance, and then it stop work and the individual is no better. The treatment for long-term anxiety is if after the talk therapy, after reducing the stress, there is still the ongoing anxiety, it's the antidepressant therapy. The antidepressant therapy is the treatment for long-term chronic anxiety or generalized anxiety, etc. Treatment for depression, reduction in the stress again, that's the talk therapy. Antidepressants, RX treatment, and there's a whole host of them. Good antidepressants with minimal side effect. And I always add the exercise, because what exercise does, exercise secretes good chemicals. It secretes serotonin in your brain, and that will alleviate the stress. And if you want to prevent depression, one of the ways of starting off is to exercise on a regular basis. And if you exercise on a regular basis, after 6 months, your whole genetic pattern will change and you get a sense of well-being. And people who have been exercising, and the research shows this very clearly. The antidepressant should be for at least 6 months to a year, depending on how well the stressors have decreased. And if the person, after a year, if the stress level is exceptionally low again, then you can consider talking with the patient whether they would they would want to come off or they would like to continue. You should remember that clinical depression is a chronic disease, and therefore it damages the hippocampus in the brain. The MRI will show that the hippocampus in the brain of an individual with chronic depression is smaller than an individual without that history. And an individual who has been treated for a long time with depression, especially if they have at least 2 recurrences of depression, the treatment for that is lifetime antidepressant therapy. And most of the, just like how, similar to just like you treat diabetes, you reduce the intake of the glucose and you give the insulin or the diabetes, the same principle. You reduce the intake of stress and you give the antidepressant. Because what we're talking about with depression is that the brain is not functioning, not managing moods as well as it used to. Therefore, the antidepressant helps the brain with the increase of serotonin, norepinephrine to manage the stressors and manage the individual's mood more significantly. It's going to be important to talk to your patient about managing the signs of stress and for you to manage the signs of stress and do something about it. Managing stress. A lot of times I see individuals that come with anxiety or depression and you ask them what's causing it and they don't know. So you have to go through with them. Talk to the individual about what has changed, what is being stressful in your life at this particular time, why you're feeling this. So identifying the source of the stress. And what you can do also is ask them to write down their activities for a 2-week period and then go through and examine what are the areas that they're getting pleasures from and the areas that are stressful to them. And you'll find that you can, if after they've written it down, you can write off many things that they are doing that they don't need to do, especially things for other people that is causing them stress and the other person might not appreciate it or themselves. Adjust in response to stress. There is nothing in life that you can't learn something from. In other words, regardless of the stress, you can reframe it to have a positive. So you should always look for the positive in the stressor. And if you can reframe it, this is a big positive. And this is especially so with COVID. COVID gives us an opportunity to relook at what is going on, to relook at our lives and reorder it. So we're talking about changing one's response to stress, reframing it, and finding methods of managing and reducing the stress. We're talking about investing in yourself, and you can do many things. You can learn a new language while individuals at home, they can exercise, they can take social media class. You can go to many Zoom conferences, you can join an organization, you can become a mentor, you can create a vision board, because if you have a vision, then you can visualize where you want to go. And I see at the bottom of it, travel. You don't have to travel abroad. You can take on exploring Jamaica and seeing the nice parts of Jamaica and do your social distancing. Meditation. This is one I highly recommend. And there are a number of YouTube channels that will help you to meditate effectively, right? And meditation, especially if it's done early in the morning. If you meditate each morning, you quiet your mind over time, and this helps you in through the day. Deep breathing exercise, especially when you are in a acute stressful situation, then you can start, this is the abdominal breathing, 10 in, 10 hold, 10 out. And if you do that for 10 times, then you automatically feel better. This breaks the stress cycle. Muscle relaxation, part of exercise again, but if you tense each muscle group, if you start with your jaw, tense your jaw muscles, your eye muscles, and you go through your body and relax them, then your fists, don't punch anybody. If you tighten your fingers, then you will go along. Exercise, I recommend everybody do 1 minute of plank when they get up in the morning. If you can do just 1 minute, you can't say you don't have time to do a minute of plank. And that helps the core muscles and breaks and increases your energy. Adapting healthy new habits, have a sense of humor. Don't take yourself too seriously. Laugh sometimes. Keep perspective and look for the positive. And very important that you encourage yourself and your patient to discuss feelings. There is no problem you should have that you don't talk to somebody about the problem. Not talking about talking to one person and telling them everything, but you should talk to somebody about the problem. And the aim is not to solve the problem. I know we doctors like to solve problems, but that's not the aim. The aim is to get it off your chest. Once you get it off your chest, what you have done is activated the neurons in your brain that is attached to that emotion, and you release some of the emotion. So talking about your feelings is especially important. And sometimes, if you don't have anybody to talk to, and I hope that doesn't apply to anybody listening, direct communication with another person may not be necessary. Writing in a journal or composing a letter that you never mail, but getting it off your chest. And most important, add something pleasurable to your life. The research shows that adding something pleasurable to your life has more benefit than simply reducing the stressful events. And we're talking about the basic human qualities of goodness, kindness, compassion, and caring. Now, I'm gonna just go through this very quickly. You know them. Don't bottle up anger, discuss it. Don't procrastinate. Learn to relax. That's the meditation. Sit quietly. Keep a sense of humor. Be polite. Forget the past. Set realistic mini goals. Be assertive. Don't sit back and wait on things to happen. Make decisions. Exercise, use mental imaging. Express your feel. Choose friends carefully. Seek company that have a positive attitude towards life, because you reflect your environment. If you are around people all the time that's negative, there's a set of cells in your brain, the finger cells, that reflect your environment. And if you are around people that's negative all the time, then eventually you are going to start feeling down. Get a massage, etc. Spend time around positive people. Help others. We are tuned. We are hardwired to help people. And if you help people, most will return the favor. And I'll say a tip on that. Be aware of your own weakness, etc., and avoid alcohol. All right, let me just go through this. And I know doctors don't do this, but it's important. Daydream now and then. A few minutes of escape can work wonders. Take up yoga. Again, stress should be managed before symptoms arise. Gonna just touch on this and then move on. Very important that doctors know this, recognizing one's feelings, managing your feeling and impulses, the core skills of emotional intelligence, empathy, develop social skill, and motivate himself towards specific goals. Finally, grant me the courage to change the things I can change, the serenity to accept the things I can't, and the wisdom to know the difference. And this is especially going to be important in this COVID-19 period. Thank you. God bless.
Thank you very much, Dr. Wright. A very interesting presentation. There you have it, audience, a comprehensive treatise on anxiety and depression. Its subtle symptoms and manifestations, its tips to resolving this problem. As you know, you can type in your questions. Dr. Wright, I think there are a number of questions awaiting you.
All right, so let me assist with the questions. The first one that came up was from Ishmael Ramos. I hope I'm saying the name correctly. Ishmael is saying, what can I prescribe to a patient that suffers from anxiety disorder and is under a lot of stress because his work is in healthcare and he's dealing with patients that have been confirmed positive with COVID-19?
One of the basic principles, that's why I went through stress in great detail. The first thing is to do whatever is necessary to reduce the stress. Because what's happening, whenever you're in a stressful situation, you have the fight or flight mechanism, you have the secretion of cortisol. So until the stressor is relieved, you're always gonna have the fight or flight mechanism in place. However, you can start by treating the individual on the short term in helping them to manage the anxiety. And that's where the anxiolytics come in. The Xanax, 0.5 milligrams twice a day, that it interrupts the stress cycle. But that shouldn't be continued for more than 2 weeks, because after that, you are going to start running into habituation and tolerance. But the treatment for anxiety disorder short term is the anxiolytic, and then later on you can move to the antidepressants. And all the antidepressants work in generalized anxiety disorder. But the solution is managing the stress. One of the things that's clear is when you're not able to change the stress, then you have to manage it. And therefore you do all the things to manage stress, the exercise, the deep breathing exercise, the meditation, the reframing, etc., etc. So those are some of the things that needs to be done. And remember, talking to the individual, listening to the individual, not giving advice particularly, but listening to the individual also will help to decrease the stress. Just having somebody to listen to them.
Great answer. The next question we have is which one to treat first? I think you might have answered this. This is from William Brown. It is anxiety, stress, or depression.
Well, you have to make the diagnosis, because an individual with anxiety is a different diagnosis from depression. And with the anxiety, without depression, I went through the criteria for depression. You should have 5 of the 9 symptoms that we talk about before you make, and you should have it persistently for 2 weeks or more. So if you don't meet the criteria for clinical depression and the individual is anxious, then you can also just treat the anxiety. A lot of times, clinical depression will also present with anxiety, and you treat both. But you treat the anxiety starting with both the antidepressants and the anti-anxiety medication. The efficacy for antidepressant, the Zoloft or the escitalopram or whatever medication you use, and you treat with the anxiolytic for 2 weeks, and then you go to the antidepressants alone. You don't keep the individual on the anxiolytic indefinitely. The anxiolytic works in a short period of time. The antidepressant take 2 to 4 weeks to start working, and at 6 weeks you reevaluate to see if you are getting any help with the specific antidepressant that you are using. Go ahead.
All right, wonderful. Again, from Mr. Brown, Dr. Brown, what are the concerns with anxiolytics? Oh, I'm sorry, what are the concerns when anxiolytics are prescribed concurrently with antidepressants?
No major problem. The research doesn't show any major problem if you prescribe anxiolytic with antidepressant, two different groups complete. And it's one of the things we often use both together to get a quick result and to get rid of the anxiety that in clinical depression that you often see. The problem with antidepressants is really the tolerance and the dependence that's developed very quickly. Also, you have to be careful with substance abuse. It's a major problem now when you have individuals who are drinking and also taking antidepressants. So you always evaluate the person, encourage them to stop drinking with the medication. But there are no contraindication with antidepressants and anxiolytics together. It's mainly with the anxiolytic that you shouldn't continue for any long period of time.
All right, so then let's take this final question and then we can go over to the poll so that we can actually ask the participants some questions. This last question is from Dr. Arna Brown Morgan. How to cope with the daily stress of being told to treat everyone as if they are COVID positive, especially at work when the patient is used to you taking your time and now you feel a need to make visits shorter?
Well, we're talking about you managing your stress, right? And yes, most of us doctors now have increased stress both at work and in the environment and at home. So what all of us have to do is to put in the coping mechanism to manage our stress on a daily basis. And I recommend meditation, and I'm sure all of us know that we are supposed to put in our half an hour of exercise, talking to one another about the issues, the stressors, not only to solve it, you can solve it, but you also need to talk about it and also doing other activities and socializing. Don't give up your social activities. I run a group at the Ministry of Health that helps people to talk about the problem. Might not be able to solve all the problem, but it helps people to identify and to share with one another how they can manage their stressor. Remember, things that you can't change, you have to accept and take it from there.
Fair enough. Thank you so much, Doc. We hand over to our moderator, Dr. Gordon, over to you. And we do have 2 poll questions that we can ask if it's okay with you, Dr. Gordon.
Yes, you could put thank you very much, Dr. Wright, for an excellent presentation. We are indeed very grateful to you. And Sam, are you ready with the poll questions?
Sure, I'll put the first one up. It'll be a pretty simple one. Everyone can vote. So I'll leave it up for about 30 seconds so everyone can vote on it. I'll leave it up for 10 more seconds. I think everybody's getting this one correct. This one might have been too easy. All right, so Doc, you should be seeing on your screen, Dr. Wright, you should be seeing the results from the poll. Any thoughts? Pretty straightforward one.
Everybody got it right.
Yeah.
Okay, yeah, but you can ask them something more.
All right, let me ask one more here. All right, this one might be a little tricky. This one will show those who are paying attention. All right, we leave it up for 10 more seconds. And then we go over to you, Dr. Wright, and you can give them the correct answer. 5 more. There you go, Doc. These are the results. So about 24% of our users voted true, 76% voted false.
So 24% got it wrong. I expected everybody to get that one right too.
Yeah.
Anyway, so it goes. I want you to remember one word, attendees, allostatic load. It's the load that we carry around from stress, and it's a very important concept. And each individual needs to do things on a daily basis to decrease their allostatic load, the stress that we carry around with us on a daily basis. God bless. Thank you.
Thank you very much, Dr. Wright, and a very excellent presentation. We move into our next phase of the webinar. We have a presentation from our sponsors, Medimpex Jamaica Limited. I think Mr. Warren Morrison, manager of Medimpex, has a presentation. Warren, are you ready?
Yes, ready, just trying to get the presentation up.
Rob, Warren, can you activate your camera as well so everyone can see you and the team? Perfect.
Yes, good night, everyone. Are you able to see this share screen?
Yeah, we can see it. And I'll just run a quick poll. Let's see if everyone can hear us at the moment. Everyone still there with us can hear. Just let us know by putting yes. All right, yeah, everyone's hearing clearly. Warren, you can go ahead.
Good. So good night, everyone. Again, I'm Warren Morrison. I'm actually the medical representative supervisor. I'd like to thank you all on behalf of Medimpex for joining us in this Association of General Practitioners of Jamaica in association with Medimpex webinar. In these unprecedented times, it is so good that we can share with you in your continuing education. Medimpex for over 40 years have been offering first-class products for healthy living, and you doctors are a very valuable part of our business, and we rely on you. Each time you prescribe one of our brands, such as Midocam or Cleon-D, Pamsol, Mycosis, Erelin, or MK Clobigen, you contribute to the growth of our business and to the health and the welfare of your patients. I would like to inform you that the 1st of March of this year, we moved to a much more spacious location, 18,000 square feet building. It's located on 21 Balmoral Avenue. This is right beside the Heart Institute of the Caribbean. The facility is much larger, of course, will facilitate our future growth. Some have expressed some difficulty in obtaining our telephone lines. So I'm gonna share with you some telephone numbers that you will be able to get us on. I'm going to get those up on the screen. Right, so this is our building that we've moved to. And the telephone lines are here. So you probably can just do a screenshot or take a picture of it so that you can get us in the future. I would also like to tell you that, doctors, we really enjoy seeing you face to face, but we'll take you however we can, even virtually in this way. I'd also like to tell you that you can like our Facebook pages, and you can find us also on Facebook, Instagram, as well as Facebook. As MedRep supervisor, I have the pleasure of working with a dynamic team of individuals. They're hardworking, they're industrious, they are efficient, ladies and gentlemen. And I would like to use this opportunity now to basically big them up, so to speak. These are, so that's me. I'm Warren Morrison. I'm the MedRep supervisor. And I'm going to highlight the other members of the team. Paul Dennis is our senior medical representative. That's Paul. Other medical representatives are Lisa Hubbard, also Christopher Fuller. We have also Ashley Wong, Sasha Dixon, another member of the team, Paulette Bedward, as well as Sinika Alexander. So this is a full team, Team Medimpex. Yeah. And they basically joined us right here. Yeah. Yeah, so that's everyone. The 1st of September, we'll have a new addition to our team. Her name is Melanie Miller. Welcome, Melanie. She has joined us on this webinar. And there will be also some changes in terms of the specific medical representative that you see. So you can look out maybe for an additional rep. She actually lives in the western part of the island, and so she'll be working in that side, but there'll be some other minor shifting around. In keeping with the excellent presentation that Dr. Earl Wright just made, one of our medical representatives, Ashley Wong, will present to you one of our products, our SSRI Stimuluton, as well as she'll introduce to you our vitamin range. So once again, thank you very much for joining us on this webinar. And please, 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 please keep safe as frontline workers in this fight against COVID.
Good evening, everyone. Today I will be highlighting our Stimuluton, which can be used in the treatment of depression. In the midst of a global pandemic, we are forced to be apart for the safety of our loved ones and ourselves. Additionally, we have been affected in many ways, such as reduction in salary. Some persons have lost their jobs, parents are working from home, and they have to be juggling that along with distance learning with their children. And all of this can be stressful. People are feeling overwhelmed and hopeless. And this can become a prelude to things like anxiety and depression. This is where Stimuluton comes in. Stimuluton is sertraline 50 milligrams, and it belongs to the class of SSRIs, which are a selective serotonin reuptake inhibitors. Stimuluton is indicated in the treatment of depression, panic attacks, and obsessive compulsive disorders. SSRIs have become first choice treatment for depression owing to their excellent efficacy, safety profile, side effect profile, because it is very well tolerated, as well as its fast onset of action. As we can see in this diagram by the Diagnostic and Statistical Manual of Mental Disorders, which was published by the American Psychiatric Association It shows that if there is no convincing evidence of major depression, psychotherapy alone is sufficient. If there is convincing evidence, antidepressant therapy along with psychotherapy is necessary. I won't go through this entire diagram. I just want to really emphasize that SSRIs are first line, which includes our sertraline, which is our stimulantron. So how do SSRIs work? They act within the brain to increase the amount of the neurotransmitter serotonin, also known as 5-HT, in the synaptic gap by inhibiting its reuptake. Of course, the more serotonin present in the synaptic gap, the better. As Dr. Wright mentioned, serotonin helps to contribute to our happiness and overall well-being. How is stimulantron dosed? For depression and OCD, it's 50 milligrams once daily with food, and the complete therapeutic effect can be seen after 2 to 4 weeks. For panic disorder, in week 1, the patient will take 25 milligrams once daily. Our stimulantron is scored, so this can be obtained very easily. And for week 2, it should be doubled to 50 milligrams once daily with food. The complete therapeutic effects can be seen after 8 to 12 weeks, and the maximum daily dose is 200 milligrams. Stimulantron can also be used in the treatment of premature ejaculation. This is an off-label indication. It is effective in treating premature ejaculation in 60% of men. And this is how it should be taken. 50 milligrams once a day for 6 weeks, then when needed thereafter. Prophylactically, it should be taken 50 milligrams when needed, 2 hours prior to sexual intercourse. All right, we're looking at the dosage adjustment for special populations. For the elderly, no dose reduction is necessary. For patients with renal impairment, no modification of dose is necessary. For your patients with hepatic impairment, a lower dose or the usual dose with longer dosage intervals. For pregnant patients, safety has not been established. And for nursing patients, it should be noted that stimulantron is excreted in breast milk. Right. So this graph is showing the effect of stimulantron on panic attacks when compared with placebo. We see there is a significant decrease when using stimulantron compared to placebo. So stimulantron is highlighted in orange and your placebo is highlighted in purple. The benefits of stimulantron include it is among the most potent SSRIs. Age has no influence on sertraline clearance. The plasma levels and clearance can be quickly and effectively controlled, and there is a small effect on the CYP enzymes, thus reducing drug interactions. Stimulantron, offering choice to your patients. Stimulantron retails at approximately $135 per tablet. With NHF, your patient will pay approximately $90 per tablet. And so this is the end result with stimulantron. It will help to lift your patients out of depression. Now I'd like to highlight our vitamin line. The brand is Prime Health, and it is coming out of Canada. We carry a very wide range, and just to mention them, so we have glucosamine, chondroitin and MSM, fish oil, omega-369. We also have Complete Adult 50+. We have multivitamins and mineral for men. We also carry prenatals, children gummy bears, and complex for women. And here is a price list just to show that they are affordably priced when compared to others on the market. Again, please note our telephone numbers. We're anticipating your calls, so please make note of these numbers. Thank you all so very much for your time and attention, and have a good evening.
Let me give you guys a round of applause because I know you can't hear it.
Thank you.
Dr. Gordon?
Yep. Thanks very much, Ashley and Warren from Agpj-Medimpex. Thanks for your continued support, and we look forward to hearing from you further. We go on to our next phase of the webinar, and it's social media and the physician. This topic was chosen because of the prevalence, the power, the reach of social media, and also because some of the complaints that was reaching the medical council as far as the conduct of certain doctors were concerned. To address this topic, we have Dr. William Aiken. We'll give a brief introduction to Dr. Aiken. I'm sure most of us know him very well. He's a senior lecturer and former head, Division of Urology, Section of Surgery, Department of Surgery, Radiology, Anesthesia, and Intensive Care at the Faculty of Medical Sciences, the University of the West Indies. He's a consultant urologist, University Hospital of the West Indies, Mona. He's the immediate past president, Association of Surgeons in Jamaica, a council member of the Medical Council of Jamaica, and he was the president of the Rotary Club of New Kingston in 2017-2018 year, and he's the assistant governor, Rotary District, 7020, Jamaica South Central. That's a brief introduction of Dr. Aiken, and we welcome Dr. Aiken to tell us about social media and the physician. Dr. Aiken, over to you, sir.
Thank you, Dr. Gordon. Thank you very much for that kind introduction, and thank you to the Association of General Practitioners in Jamaica for inviting me to share this presentation. I'm sure many of you are wondering what does a glorified plumber or a urologist rather know about social media use. But there is a backstory to that I'm going to share with you shortly. In the interim, let me just try and share my slides. I see them here. Is everyone seeing my slides?
Yes, Doc. It's coming through clearly. You can go to full screen if you'd like, or you can continue as is if everyone can see it clearly this way. I think they'll see better at full screen.
Okay.
While they're doing that, let me just check with the sound check for everyone again. Is everyone hearing Doc clearly? Give them a sound check, Doc.
Testing, testing.
Yep, 100%. All right, good. Over to you, Doc.
Okay. Okay, so as I said, you're probably wondering what is a urologist doing talking about social media. So there's a little backstory to that. And let me just find my correct slide. So this is the title slide. The Medical Council of Jamaica, the present council, was constituted in January of this year, after which we elected our chairman, Dr. Kenneth Vaughan, and I was asked to chair the subcommittee of the Medical Council looking at ethics. And one of the things that quite a few members of the council and other persons were complaining about was the inappropriate use of social media by physicians. And so it was felt that this should be given a priority in terms of the work of the ethics subcommittee. So the objectives for my presentation are listed here. I won't read them because I'm sure you're seeing them, but these are the 5 objectives of my presentation. I have no conflicts of interest to declare. So as I was saying, I am the chair of the ethics subcommittee of the Medical Council of Jamaica. And the other members of the subcommittee are Dr. Tomlin Paul, who happens to be the Dean of the Faculty of Medical Sciences, Dr. Winston Delahaye, a Vice Dean of the Faculty of Medical Sciences, and Dr. Althea Akar, a consultant internist and pulmonologist at the University of the West Indies. And as I was saying earlier, based on several complaints reaching the council, we thought we should focus on the use of social media by physicians as one of the first things that the ethics subcommittee should look at. But before we get into the guidelines that were drafted and so on, let's be very clear what we're speaking about. Most of us, I'm sure, know what social media is, but the definition is that it is defined as websites and applications that enable users to create and share content or to participate in social networking. That's the Oxford definition. An alternative definition is that social media is a computer-based technology that facilitates the sharing of ideas, thoughts, and information through the building of virtual networks and communities. Users engage with social media via computers, tablets, or smartphones via web-based software or web application, often utilizing it for messaging. And that's from Investopedia. So these are some examples of popular social media sites. I'm sure these, well, the first 8 are familiar to most persons. The top 5 being perhaps the most popular. Doximity, the last one mentioned, is a social media site in the US specifically for registered doctors and physician assistants. There are 3 main categories of use of social media by medical doctors. Doctors use social media for their private and personal use by sharing of information, by way of sharing information with friends in their networks. It is used by medical professionals, increasingly so, to promote and advertise their services and display their work to the wider public and online community. And we certainly see increasing use of this category of use by medical doctors. And thirdly, it is used to communicate with colleagues. There are other uses of social media, of course, that we will allude to later on in the presentation, but these are the 3 main uses of social media by medical personnel. I should say at this point that the focus of the talk tonight is on the use of social media by doctors and the effects thereof, not the effect of social media use on medical personnel. That's a whole other topic by itself. So before we get into the substance of our talk, there is something known as the digital footprint, which is very important to this talk and which we should have a clear understanding of what it is and the relative permanence of it. By definition, it is the information about a particular person that exists on the internet as a result of their online activity. That's the Oxford definition. An alternative definition is that the digital footprint refers to your unique set of traceable digital activities, actions, contributions, and communications manifested on the internet or on digital devices. And this is by a definition by Wikipedia. There are 2 types of digital footprints. There's an active footprint based on postings that you make, filling out of forms, emails sent, communications that you send, agreeing to install cookies on your devices. That's considered as active digital footprint. But there is an insidious and surreptitious digital footprint, and that is the information that is collected from the user without the user knowing that this is happening. And so if you visit certain sites on social media, this information is collected on you. And for example, when you search for things based on the pattern of your use, certain things will come up when you use things like Instagram and Facebook. Now, although posts can be deleted, the digital footprint that your post leaves is best considered permanent, as persons in your network may have copied and shared your content. And there are very sophisticated ways to find your digital footprint even after you have deleted stuff. So this is a very important consideration when we're talking about social media use. So let's look first at the private and personal use of social media. The vast majority of persons, doctors including, use social media for their private or personal use. And these are personal and private use refers to postings made on social media which leave a digital footprint which may be accessible to potential employers, current employers, and other agencies, and can be used to judge the character and reputation of the doctor in question. Now, regardless of the privacy settings that you may dictate on your various social media platforms, it's important to understand that the digital footprint in your personal and private space can be researched by both current and prospective employers and other persons. And this is frequently used. Persons, for example, going for an interview, the interviewers may look at your social media profile. We all know that your social media footprint or digital footprint is used by TSA and other agencies to determine whether you pose any serious risk, you know, to the security of the United States and so on. So information that you post on social media in the privacy of your personal and private use can be researched and can be looked up and can be held against you if it is felt that you have made posts which are considered offensive or defamatory or damaging in any way or inflammatory to a particular person's race, groups, demographics, gender, populations, or nation. In fact, there are several cases, well-known cases of persons who have been fired from their jobs because of their social media use. Just recently, a nurse was fired from a well-known hospital in the US because she made an inflammatory post about the Black Lives Matter movement. And although this was made on her personal, in her personal space, it was felt that since she was an employee of the hospital and she was a representative of the hospital felt that she was not at liberty to make that kind of comment without suffering the consequences. So she was actually fired. The First Amendment right does not, which is your right of free speech, does not protect you from the consequences of what you say. It protects persons in the US from the government interfering in what you, or preventing you from articulating how you feel, but it does not prevent private entities from firing you if they think the language or the content of your language was inappropriate or offensive to any particular group. So before posting or sharing or forwarding anything on social media, you should first verify its authenticity. But even if it's authentic, you should ask yourself whether it's prudent, whether it's lawful, or whether it's ethical to share it. Now, something may be true, but is it lawful to share it? For example, if somebody sends you a video of a minor being sexually abused, in Jamaica, it's illegal to share that content. It doesn't matter if it didn't originate with you. If you share that content, then you are breaking the law. Even if you are not breaking the law, though, is it ethical? Or code of ethics says, first, do no harm. Harm does not only include physical harm. It could include harm to the reputation of the individual, or harm to the individual's emotional and mental health. So before sharing something, ask yourself, is this ethical to share? Is it lawful? Is it wise to share it? And ask yourself, what are your motives for sharing it? Is it just to get some likes? Because if that is the case, then that's a very puerile and immature reason for sharing content that may reflect negatively on another person. Ask yourself, do you have the authority or permission to express a specific idea in your private space? Because let me give you an example. You may work at a hospital, and you, by virtue of working at a hospital, you may have certain privileged institutional knowledge about that hospital. For example, you may know that the hospital's resources are insufficient to cope with a particular problem, although the official position of the hospital is that everything is fine. It would be inappropriate for you in your private social media post to share information on the resources of the hospital, because you are not an official spokesperson for the hospital. You have not been authorized to speak on behalf of the hospital. And so it's important to understand these issues. You can be fired or be disciplined for speaking out of turn if you are not, if you do not have the permission or the authority to speak on behalf of an institution, notwithstanding that what you're saying may be completely correct and true. Do you think you're sufficiently competent to speak on a particular issue? If you don't think you are competent to speak on it, then perhaps you should defer or rather not speak on a specific issue that you think you're not competent to speak on. It goes without saying that you should never falsely accuse any person on social media. So, it goes without saying that you should never commit slander or libel on social media. Now, that's a tricky one, because you may have been, for example, the victim of a particular abuse at an institution, and you feel you're not getting the justice that is required. And you go on social media and you mention that you have been the victim of a particular abuse, perhaps sexual abuse, and you name the alleged perpetrator on social media. Now, you may be correct, you may have actually been the victim, but unless you have proof, then that would be an inappropriate place to put that kind of information. The appropriate action would be to seek legal recourse, or if it's a criminal matter, to go to the police. But once you put something on social media, calling someone's name, they're going to, of course, defend their reputation, and they're going to say that it's not true. And if you can't prove that it's not true, you may be facing a tremendous lawsuit. I'm a Rotarian, and I find that the rotary four-way test may be helpful in deciding whether it's prudent to post something on social media or not. The rotary four-way test asks 4 questions. Of the things we think, say, or do, firstly, is it the truth? Secondly, is it fair to all the parties concerned? Thirdly, will it build goodwill and better friendships? And finally, will it be beneficial to all concerned? So I think that is a fairly good test of, or certainly something you should consider before making any posts on social media, even in the personal and private space. Now, it is considered best practice not to mix personal and professional use of social media. And a number of medical associations and medical councils internationally actually have their social media policy guidelines that they've published. Several of them recommend that you should not actively seek out and befriend your patients and or their relatives on social media. So you are a doctor in an office, you're seeing a patient and you happen to like your patient's daughter, and having left the consultation, you decide to go on social media networks and seek out and befriend your patient's daughter. That is considered inappropriate and would be frowned on. It is also considered best practice not to accept friend requests from your patients on social media in your personal space. It is thought and felt that it's best to keep your personal persona separate from your professional persona. Physicians should not answer medical questions from patients on their private social media platforms, but should instead direct them to appropriate professional channels of communication. For example, you could have a special WhatsApp number dedicated for use by patients. And if you decide to text message patients, the verbal consent of the patient for use of that medium should be obtained before doing so. It is felt by some medical associations, for example, the GMC in Britain, that should be done before messaging patients. What about the use of social media to promote and advertise services offered and or display work done? This is perhaps the part of the presentation we want to focus on tonight. And this is an important area, and where the majority of the complaints have come, informal complaints I should add, have come to the medical council. So here we're speaking about the use of social media to promote the skills and services offered by doctors. And this falls within the realm or ambit of medical professionalism. And therefore, this is an area that can be policed by the Medical Council of Jamaica, because what you display and on social media in terms of promoting your work can either positively or adversely affect the medical profession and how the public views the medical profession. Now, in terms of professionalism and the use of social media, from a professional point of view, we looked at the 10 components of medical professionalism identified in the Physician's Charter, titled Medical Professionalism in the New Millennium. And there are 10 elements or components to this construct of professionalism, or medical professionalism, that is. First, let's speak about professional competence. Then honesty, being honest with patients. Patient confidentiality is a huge issue. Maintaining appropriate relations with patients is another element. Improving the quality of care in our interactions with patients and improving the access to care. We speak about the just distribution of finite resources. Scientific knowledge, which should be brought to bear on our interactions with patients. Maintaining trust by managing conflicts of interest. And finally, our professional responsibilities. So these are the 10 components or elements identified in this Physician's Charter of medical professionalism in the new millennium. And what we did to prepare or the committee did to prepare the draft document on the use of social media by medical professionals in a professional capacity was to use these 10 components of medical professionalism to prepare our draft document. So we're going to look at the draft document now, and I emphasize that this is still a draft document. So these are the Medical Council Jamaica draft guidelines on the use of social media. And these are based on the elements of medical professionalism we just looked at. So the first statement or first guideline is that no physician should post, upload, or portray images, words, or testimonials with the intention to give the false impression that they are competent in any procedure or skill for which they do not have the requisite training, certification from a recognized institution or body, and or widespread recognition by their peers that they are specialized in that specific area. Now, this is a point of contention because in Jamaica, as you know, there's no legislation as yet for a specialist registrar. And the fact is, anybody with an MBBS can practice any branch of medicine that they so desire. However, we feel very strongly in the Medical Council of Jamaica that doctors should not portray on social media that they are competent in a particular area when in fact they are not. And we feel that at the very least, you should be judged by a body of your peers to be specialized in that specific area for you to portray that. We know that some persons may have been grandfathered into a particular specialty by virtue of experience, qualified by experience, and not everybody may have a certificate. And some people may have received the requisite training via experience. But the bottom line is, if your peers don't recognize you as a specialist in that specific area, you're not a specialist in that area. So the second guideline is that in their postings on social media to promote a particular procedure, physicians should give a balanced and honest and realistic appraisal of the benefits and risks by ensuring that alongside the images portraying successful and desirable outcomes, they include wording that conveys the risks of the procedure. Physicians should not minimize or sugarcoat risks by not mentioning them at all or placing them in an inconspicuous position. So we see a lot of social media posts, especially by persons doing cosmetic procedures where they post these lovely before and after procedures. And of course, we know that all procedures have attendant complications, even if you do them perfectly. And of course, the general public, when they look at these lovely pictures, they may get the false impression that everything goes well all the time. And this would not be an honest portrayal of the situation on social media. So we feel strongly that, you know, persons promoting their work, especially cosmetic work, should balance what they show and give an honest and realistic impression by putting the necessary wording on their social media sites to give patients a realistic impression of what can go wrong, the pros and cons of the procedure and the things that can go wrong despite their best efforts. The third guideline is that physicians should always maintain, and this is a biggie, physicians should always maintain the confidentiality of the patient, even in situations where patients have given their expressed written consent to have their images published. Efforts should be made to conceal the identity of the patient. Failure to do so may erode public trust in the medical profession. Breaching patients' confidentiality is a serious offense and is unprofessional, and serious sanctions can be applied to any physician who breaches this. Now, we feel that even in situations where patients give written informed consent, and yes, written informed consent should be obtained to post images of patients on social media. We feel it is best practice not to show their faces. And we also feel it's best practice to maintain the dignity and decorum of the profession by being very careful in what is posted in terms of nudity, etc. And we're going to touch on that later in the guidelines. Physicians should also never take pictures with patients showing their faces unless they have written consent to do so. There's an instance recently of a nurse, again a nurse who was fired from her hospital post because she took a picture of a patient, posing with the patient, saying this was her best patient, but the patient did not give any consent for her to upload his image to social media. So one has to be very careful with respecting the confidentiality of patients. And in Jamaica, we see physicians on social media putting patients' images with the patients scantily clad with very little clothes on. And in some situations, their faces are shown. I think this is highly unprofessional, and the medical council is going to act severely where this is concerned, because this is definitely unprofessional behavior. Physicians, the fourth guideline is that physicians should behave appropriately with patients and should not post anything online that would be considered inappropriate in the regular practice of their profession. Physicians should conduct themselves with dignity and decorum when interacting with patients in keeping with professional standards. Inappropriate touching, sexual innuendos, verbalizing appreciation of the patient's body parts, use of offensive or foul language, and/or offensive or foul music are all proscribed. In their social media posts, physicians should always seek to protect the dignity of their patients, their own dignity, and that of the medical profession. Again, we have seen social media posts where scantily clad patients are being inappropriately touched by the physician on social media. We see patients being hugged. We see patients being caressed. We hear physicians making inappropriate comments about patients' body parts on social media. All of these are unprofessional and highly inappropriate and will be acted on. So, you know, who has ears to hear, let them hear. Physicians should ensure that their postings on social media promoting their practice are for the overall net benefit of the patient through the provision of useful information and do not exist simply for self-promotion. The opportunity should be used to educate patients and facilitate informed consent. So again, you know, physicians' use of social media, this is a great opportunity to educate patients. And even when you're promoting your practice, you provide added value by educating the patients. And so we feel that you should not be simply just promoting yourself, but you will be adding value through the education of patients. The business address and contact details of physicians should be clearly identified in their social media posts promoting their practice. This is so that you know, we can police and regulate the practice and know how to get in touch with physicians. And so no post on social media promoting a particular practice should be done surreptitiously. The contact details and the address of the physician should be clearly visible or identifiable. Physicians should not promote or endorse any concoction, procedure, drug, or device on social media when there is insufficient scientific or medical evidence for that drug or procedure or device. Physicians should declare to patients all potential conflicts of interest. A number of physicians own entities that distribute medical devices, and sometimes on their social media posts promoting the procedures they do, they may refer to these entities for patients to go and purchase these devices. Physicians ought to declare all potential conflicts of interest to maintain public trust in the medical profession. All potential conflicts of interest should be declared. And finally, the dignity and nobility of the medical profession should always be paramount in any social media posts, and it should be maintained and protected in our interactions on social media. We should never do anything that brings the medical profession into disrepute on social media, either in our private or professional postings. So those are the guidelines and that we have come up with so far. And I emphasize that this is still a draft document, and we are going to be seeking wide stakeholder consultation across age groups in terms of the medical profession, so that we get an intergenerational point of view. As we know, our millennials and younger doctors are very proficient with the use of social media, and it's important to have their input and their feedback in the formation of any guidelines, so that they can be fair and current to all concerned. Other uses of social media by medical professionals, which we're not going to dwell on tonight, which are equally important, include sharing information, debating healthcare policy and practice issues. A big one is promoting health behaviors and to engage with the public. This is an underutilized use of social media. I believe we can be of greater public good in terms of promoting healthy behaviors by what we post, certainly in our private as well as professional posts on social media. Of course, it's also used to educate and interact with patients and caregivers, and to educate and interact with students and colleagues. So in drafting this document, we also looked at the social media use policy by certain medical associations and councils. We looked at the General Medical Council, the American Medical Association, the Australasian Medical Association, the Canadian Medical Association, and the British Medical Association. And their social media policy guidelines are all quite similar. We are not reinventing the wheel here. And certainly in putting together these guidelines, we have looked at these other social media guidelines for guidance. So in terms of the further guideline development, an initial draft of this document has already been presented to the full council, full medical council board. Modifications to it were made, suggested on feedback from the medical council. And the next steps are to involve wider stakeholder consultation by soliciting the help of the JMDA and the MAJ to get their input, and particularly to get the input of younger doctors in their 20s and 30s who are regularly on social media and who influence public opinion by their social media posts. This is an iterative process of consultation, amendment, review, further consultation, amendment, review, until we get the final document. The final document, of course, will be presented to the medical council and will have to be ratified by the council, and the timeline we're looking for in doing this is December 2020, December of this year. I believe this is my final slide. this is a very controversial topic, as was mentioned earlier. I'm sure there might be a lot of questions and a lot of comments, and I welcome these. And if I can answer your questions, I will certainly try. Thank you very much for listening.
All right, thank you so much. Dr. Gordon, I would hand over to you, but I think what we can do, Dr. Aiken, is I can just thank you for what was a really good presentation. And I'm not just saying that in the chat, it's blowing up like a social media event. You're going viral. I'm seeing here very excellent guidelines so far, very interesting, etc. So everyone is in agreement, not much questions. I think they're more appreciative of the presentation as we all are. Would we want to go into a few polls just to see if persons are paying attention and see if I can trick them? Let's run a few polls and see what we can get out of them here before we hand over to Dr. Gordon. All right, so on your screens, you should be seeing the first poll. You can select as many that apply. Which company or application from the list is considered social media? Oh, wow. The very popular ones jump up first, boy. Okay. Doc, I think you guys are gonna love these answers. All right, 5 more seconds, and then we'll end this poll and move to the next one. All right, coming in on your screen now, Doc, you should see the results. I see Helsha Beach and Uncorked are very popular social media. Very popular social media ones there. All right, but I think I can help and support Doc in saying that WhatsApp is a very popular social media application. Facebook, of course, one of the first most popular ones. Instagram. I should say that Instagram, WhatsApp are all under the family of Facebook as well. And of course, the new rave is TikTok as far as this list that we have here. Let's go with another one real quickly. So as defined by Doc in his presentation, there were 3 main categories. Which one of these is best suited? Oh, we're getting some excellent participation. All right, let's end this one in 5, 4, 3, 2, 1. There you go, Doc. So 82% of persons, I think, got this one corrected, yeah? Got this one correct?
Yes.
If you're not seeing the poll questions, it could be because you're on your phone. It should be popping up, or you're connected via the web. Let me try again and see if you guys are getting this next poll one now. Physicians should ensure that their postings on social media promoting their practice are for self-promotion only. Doc, you can't smile, he might give away the answer. All right, and we end this poll in 3, 2, 1.
Wow, that's interesting.
Very interesting, I thought.
So that 18%, they may not have agreed with what was said. They may feel that, you know, social media posts promoting one's practice should just be for that purpose and not for the wider public good in terms of educating. But I would, the Medical Council of Jamaica, I believe, would disagree with that position. We believe that you should add value and provide a public good to the general population.
Definitely. I do see now where there are 3 questions. I don't know, Dr. Gordon, could we take 1 or 2?
Sure, go ahead.
Okay. So William is our number 1 participant tonight, William Brown. Since social media is growing, can we charge points? Since social media is growing, can we charge points for use on a daily basis? I'm not sure what he means by charging points there either.
I'm not sure I understand the question.
Yeah. Richard Reed is asking, should you document social media consultation to your paper file?
Is he referring to the use of social media for consultation?
Good question. Richard, if you're hearing, he said yes. That's what he's speaking about.
Okay, well, especially in these times, online consultations are becoming increasingly important because as social distancing is very important public health maneuver to decrease the COVID pandemic. A lot of online platforms for consulting doctors have been developed, and those that were there before now see an increased uptake. And so this is an important important area that I think will, even after the pandemic is over, is going to continue to be highly utilized in terms of consultations between physicians and between patients and physicians. And that has its own set of rules in terms of use, some of which are similar, very similar to what we mentioned here tonight. Patient confidentiality is a very big concern, and how these electronic medical records ought to maintain confidentiality even when sharing between different information on patients between different doctors. So patient confidentiality is a major concern of these online consultation platforms, and going forward, patients need to be assured that their information will be secure and won't end up in the wrong hands. That's a major concern.
Fair enough. Dr. Brown clarified. Dr. Brown is saying, should we charge patients for social media usage, as social media is so growing now? So if we use social media, I'm assuming, to engage with our patients, should we now be looking into charging patients?
Well, certainly in terms of dedicated online platforms for medical consultation, that is an accepted, that's accepted in terms of platforms. I shouldn't mention any by name, but one that comes to mind that's local is eDosine. Those are already established, and patients already pay for consultations on those online platforms. But for the regular social media usage on things like Instagram and Facebook and other social media sites, I don't see how we would be able to charge patients on those platforms. That doesn't, I mean, you may be able to derive income from patients in other ways, but I don't think you could charge patients for using those platforms to engage with you.
Fair enough. And I think there may actually be in the Facebook, WhatsApp, Instagram, etc. Code of use where they actually are saying that they're trying to prevent that type of use for their program. So as you're saying, it's possible that persons would have to create or use some other type of social media specifically created for that. Mr. Brown continues, has the MCJ approved prescriptions on social media?
Well, that is something that we're currently examining in association with other medical groups and of course the pharmacists as well. So that is something that is currently under consideration by the Medical Council of Jamaica, particularly in this COVID pandemic.
Okay, fair enough. What is the legality? This is from Dr. Arnon Brown Morgan. What is the legality of WhatsApp prescriptions that are sent to pharmacies?
I can't answer that question, but I know that the Medical Council is looking at that as well. It's certainly something that is being used. It's already being used, but whether it is actually legal is a question that I'm not competent to answer. I would have to research that, but it is something that is actually being utilized as we speak. And the Medical Council, in terms of the whole review of online prescriptions and so on, is also looking at that.
The pharmacists have to get the hard copy. They can't take the online, the WhatsApp copy alone. They need to get it within, I think it's 2 days or something like that.
Yeah, that is actually so. But of course, we know Dr. Wright, that sometimes that does not happen, but that is what ought to be done. Yeah.
All right, so the next question, we're taking it in chronological order. I see persons having questions to follow up to that one, but Dr. Brown asked again, what are the medical ethical implications of misdiagnoses and how are doctors protected by MCJ? I'm assuming over social media.
Well, the Medical Council has not examined that issue, but it will, I think the same issues related to competence and negligence and possible harm that would apply in a face-to-face consultation with a patient would apply given the limits of interaction over social media and making a diagnosis using, I shouldn't use the word social media, but using various online platforms that may be used for consultation. So, if we are not unreasonable people, and certainly if you are assessed by a group of your peers and it is felt that a diagnosis that only could have been made by physical examination was missed, then I believe a group of your peers would find it very difficult to find you negligent in a situation like that. So these are issues clearly, as increasing use of online platforms for consultation become more prevalent, that we'll have to look at.
Can I make a comment?
Definitely, Doc.
I think the MAJ, in unison with the Medical Council, they are planning to look at the whole business of telemedicine in terms of legalizing it and bringing it to Parliament and having a proper discussion on the whole issue. So, I mean, that is something that is in the works presently. The last time I spoke with the president of the MAJ, they said they were scheduling a meeting with the medical councils and other bodies to discuss this with a view to bringing it before the lawmakers. A question or comment I want for Dr. Aiken is that you spoke a lot about physicians posting on social media, but there is a practice sometimes where patients and their relatives visit the doctor and they start a video the activities of the doctor. Like, I had an experience where I was suturing a child, and the relative was using their camera to videotaping what I was doing. And, I had to ask them to stop. What is a doctor's right if a patient starts videotape? How can you prevent that from being widely dispersed?
I think it is well within the doctor's rights and authority to insist that the relative or the patient, if it's a patient, not record any procedure done in the doctor's office. I think that is well within our rights. I don't think any patient could insist that they would want to continue recording while they're in the presence of the doctor, if the doctor does not give permission for such a recording to take place.
Yeah, but what about what might have gone on before you discover it? Because, I mean, it's, while I was paying attention to suturing, they were behind my back videotaping. And it's when I saw the light through the corner of my eyes that I asked them to stop. What about that footage that had gone on already? I mean, what can I do about it? Or what can a doctor do about it?
I think a doctor would have to put out some kind of disclaimer that, you know, they had nothing to do with this video tape that has gone on social media. It was done without their permission or consent, and they would have to make that very clear.
I mean, I did ask the patient to stop and to delete, you know, but I don't know. They said they did, but one's not sure.
Yeah.
I think it's a great question, because it's actually gotten persons in the chat kind of going and discussing, because they're saying that that's something that happens commonly. I think, as Dr. Aiken says, though, one would feel that a physician is within their rights to, ahead of time, during and after, just reinforce that recordings are strictly prohibited, and just ask that patients and their guests who are there with them follow suit with that.
Mobile, that's an excellent point. Mobile phones are so pervasive and commonplace that perhaps in the future or now, we may have to put a sign in our practices that video recordings while on the compound of the medical practice or facility are strictly prohibited. That is something that may have to be, you know, there may need to be a sign saying that, so patients know ahead that no recordings are allowed.
Fair enough. All right, Dr. Gordon, over to you. Thanks, Dr. Aiken. That's it for my questions.
Thank you very much, Dr. Aiken, for introducing us to the guidelines. It was a topic that was sorely needed, and I'm sure it opened a lot of our eyes, and it will make us a bit wiser to the use of social media. And I'm sure we all benefited from that discussion. We're going to wrap up by saying thanks very much to Dr. Aiken and Dr. Wright. And Mr. Morrison is going to give the thank you on behalf of the rest of the program. Mr. Warren Morrison, can you please come in, please?
Hello, it's Sasha Dixon, one of the medical reps. I will be doing the vote of thanks.
Okay, Sasha, go ahead, please.
So again, good evening, everyone. It is my pleasure to deliver to you the vote of thanks for this occasion. I would like to first and foremost thank God for keeping us in good health during this pandemic. It has certainly taught us to be innovative and resourceful in all areas of our lives, such as utilizing technology to stay connected and to keep informed via webinars such as these. With that said, I would like to thank Dr. William Aiken, the chairman of MCJ's Ethics Committee, who presented on social media. COVID-19 certainly came with challenges that impacted many of us mentally, professionally, and socially. I would therefore like to thank Dr. Earl Wright, consultant psychiatrist, who presented on anxiety and depression. I hope that we are now better equipped to cope and maneuver our way through this new normal. I would now like to thank Dr. Donald Gordon and the Association of General Practitioners of Jamaica, who are the organizers of this webinar. Special thanks to Mrs. Lynn Thompson Hyatt, the administrator of Agpj, who was instrumental in putting all the details in place. She was readily available to answer all our questions and concerns with regards to planning this webinar. I would like to thank too Mr. Samuel Heron project consultant at Oldgate Solutions. He's the man working behind the scenes to ensure that we had a successful webinar with regards to everything IT related. And lastly, I would like to thank you, the physicians, for taking the time to spend your evening with us. Without you, this would not have been possible. We thank you for your continued support of Medimpex over the years and also in the future to come. Have a good rest of the evening.
Thank you.
Thank you very much.
Have a good night.